The federal government has been shut down now for weeks, and a big part of the fight is over health care.
And at the center of the standoff, a debate over a policy that helps lower monthly insurance costs for people who buy coverage on their own. KCCI chief political reporter Amanda Rooker gets the facts on what's at stake for Iowans.
Yeah, there's a lot at stake here, Lara and Jody. Democrats want to extend some Affordable Care Act subsidies that were originally passed in 2021 that lower monthly premium costs. Republicans say that discussion needs to wait until after the government reopens. We are getting the facts on how much more Iowans could have to pay if these subsidies expire at the end of the year.
The Affordable Care Act, or ACA, makes health insurance more affordable for people who don't get coverage through their job or Medicare. That includes self-employed people like farmers, freelancers, and independent contractors, also small business employees and early retirees.
Roughly 150,000 folks are getting their coverage through the marketplace in Iowa.
Dan Shane, a health policy professor at the University of Iowa, says those people receive subsidies, which are basically discounts on their monthly premiums. During the pandemic, Congress expanded those subsidies, lowering or even eliminating premium costs for some families. It also capped how much people have to pay each month based on their income. Shane says that made insurance much more affordable for middle-class Americans.
They had the most to gain because in some cases that, the premiums were in the thousands of dollars per month for those folks.
Those enhanced subsidies are set to expire at the end of the year.
If they were to lapse, on average, the premiums double.
So if you're paying $500 a month right now, you'd have to pay $1,000 a month for health insurance next year. But Shane says that cost increase would change based on your income, where you live, and your age. Older people in more expensive areas would pay more.
If you're somebody who, again, is in that pre-Medicare, right, 60, 61 years old, maybe it's you and a spouse or partner that you're covering. Right now, the insurance may be $600 or $700 a month. I mean, I've seen estimates that in some cases going to, $1,800 to $2,000 a month for your health insurance.
The nonpartisan Congressional Budget Office estimates that if the subsidies expire, roughly 2 million Americans will lose their health care coverage next year. The open enrollment window starts on November 1st, and families have to make a decision by December 15th. Shane recommends shopping around within the marketplace.
There could be a better option even within this environment where the enhanced tax credits are gone, but there may be at least some savings available by switching plans.
Now, if you are someone who doesn't rely on these subsidies, but you do get your health care insurance from the marketplace, experts say you'll likely also see your insurance premiums go up. Experts say that's because when healthier people drop their coverage, it drives up costs for everyone else. Live in Des Moines, Amanda Rooker, KCCI 8 News, Iowa's news leader.
A big impact on a lot of people. Thanks, Amanda, for getting those facts. KCCI will continue to follow the efforts from congressional lawmakers should they agree to a funding bill and reopen the government. You can download our free KCCI app and turn on alerts to make sure you never miss the latest update.